I'm going to go ahead and get started. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the ThriveKY campaign, and it's great to see such a big crowd with us today. I hope everyone is doing well and staying safe in this weather. And speaking of the weather, between the flooding that impacted so much of our state in April and the deadly tornadoes that came through Pulaski and Laurel counties on Friday, our hearts are really with everyone who's been touched by these disasters. And I think in these moments, it's a really good reminder of why we need such a strong safety net. And so I think the timing of this call is important. The updates that we're going to be sharing today, I hope will be helpful to you as you are, responding on the ground in your communities, advocating for the resources and the programs that your community members need in order to thrive and be healthy and to recover from these disasters. And so I'm really grateful to have so many members of the Cabinet for Health and Family Services leadership with us today for this call. This is, I think our last call was in March before the legislative session ended. So there's a lot to catch folks up on in terms of things that happened during the session, bills that passed that are going to be implemented, other things that have been happening at the federal level, changes to SNAP and Medicaid and other programs. And so looking forward to sharing these updates today. We can go to the next slide, Alex. For those of you who are joining us for the first time, may not be familiar with Thrive Kentucky, our mission is to meet the basic needs of every Kentuckian through systemic change, because we recognize that many of our fellow Kentuckians have faced historical and systemic barriers to meeting those basic needs. So you can see the principles that guide our policy advocacy work on this slide. You'll get these slides emailed to you in a follow-up email, so don't feel like you have to read them now. Our campaign partners are here. If you want to learn any more about any of the organizations that are part of Thrive, you can follow those hyperlinks. And we can go to the next slide. Just as far as housekeeping goes, we ask that people keep themselves muted. We have a lot of folks on the phone. We are recording this and we'll be sharing that recording out along with the slides and any resources that are shared today, whether they're on the slides or in the chat. We compile all of those and put them in a follow-up email. So watch for that in your inbox tomorrow. We also provide CEUs for certified community health workers and for social workers. And so if you'd like to get credit for attending today, you need to make sure to take the evaluation that will be coming in the follow-up email. We want everyone to give us their feedback. So everyone is welcome and encouraged to, respond to that evaluation. But if you need CEUs, that's a requirement to make sure to complete that. And we can go to the next slide there. Always want to say thank you to our sponsors for helping us put these events on, making them free, offering those CEUs to folks at no cost, tripping over myself, and just giving us the support that we need to not only do these webinars, but also our roadshow, which I think might be on the next slide. We're really happy to have you all here today. Hopefully you've tuned into some of our other webinars this year. We have a number of other webinars, coming up, and where we do our state and federal updates, and then these forums with the Cabinet for Health and Family Services on about a quarterly basis. And then in addition to that, we like to, go around Kentucky to different communities and do a little bit of a longer program where we talk about some of these programs, do some advocacy training, and provide lots of other updates. So hopefully you can join us for one of those roadshow events, and you can see all of that information on that slide. And then next slide. Here's the agenda that we're going to be covering this afternoon. So I mentioned, we held our last forum in March, so we do have quite a bit to catch up on, and particularly at the federal level. And our goal with these forums is really to create more of an open dialogue between cabinet leadership, consumers, and advocates. And we want these webinars to be an opportunity for you to get the updates that you need on our safety net programs, to share feedback with the cabinet, and to ask questions. So as we go through each section, just put any questions or comments that you have in the chat. We like to kind of address those as we go as much as we can. And if we can't cover everything during the next 90 minutes, we'll make sure to cover it in the follow-up email. So with that, we're going to go to our first section, which is an update on the measles outbreak that we've been hearing so much about. And I should say measles outbreaks in different parts of the country. Luckily, we have been spared that here in Kentucky so far. And then just an update on childhood immunizations. I'm here with Dr. White from the Cabinet for Health and Family Services Department for Public Health. And I should say, before I move on, I'm sorry, I skipped ahead. I want to go ahead and I got a little out of order with the slides. I need to acknowledge everyone who's joined us from the cabinet. So apologies for that. Today, joining us will be Secretary Eric Friedlander, Medicaid Commissioner Lisa Lee, Medicaid Senior Deputy Commissioner Veronica Judy Cecil, Medicaid Deputy Commissioner Dr. Leslie Hoffman, Division of Health Plan Oversight Assistant Director David Very, Department for Community-Based Services Commissioner Lisa Dennis, Director of the Division of Family Support Roger McCann, Department for Public Health Deputy Commissioner Dr. Connie White. So with that, I want to just turn it over to you, Dr. White, to tell us a little bit about what's happening with measles right now in Kentucky on the ground and what information our advocates and community professionals need to know to educate their members of their communities and to help them navigate finding immunizations.
Good afternoon, everybody. Thank you for coming. Thank you for attending these meetings that I always find them educational, and I'm in the middle of all of this at CHFS. So it's very helpful for us as a group to connect. The measles outbreaks, as Emily said, you've heard about these. There are many states involved now, and there are more than 1,000 cases of measles that have been diagnosed. We're sure that there are more that have happened but have not been diagnosed. And at this time, 128 or 13% of them have been hospitalized. People are not hospitalized to quarantine. People are hospitalized because they're sick. So 13% of those folks have been ill enough to be hospitalized, and there have been 3 deaths. In Kentucky, we have had 2 cases. One of which here in my hometown, and fortunately everyone that this person contacted had been vaccinated, so we had no cases from that person, so we're very fortunate there. And the other was someone driving through that got notification that their child had been in a classroom with a child with measles, and so they were all going on vacation. They turned around, came back, called ahead to a hospital to have their child checked, so that was very important. The hospital knew, so they were able to bring that child and that family in and not expose the entire reception area and every provider in the emergency department to a measles case. So very important, if you think that you know someone with measles, that whoever you contact, whether it's a provider office or whether it's an emergency room, call them and let you know they're coming. Measles is one of the most contagious diseases that we have. So it's really important that you let people know what you think. We've done a lot of measles testing since this all started, but the rest of all of the cases we've tested have been negative. We do a survey at the Department for Public Health where we check the vaccination levels of kindergarten level kids. I believe it's 6th grade and high school. Don't hold me on that, but I do know it's the kindergarten kids, because the reason it's important in the last school year, we only have 87% of our kindergartners are vaccinated and receive their MMR. So that's measles, mumps, and rubella. So that's way below what we were before we had our COVID pandemic, which it was more 92, 93%. And you need that percentage to get that herd immunity that everybody has heard about. So we are way below that in our kindergartners. We are statewide back up to 90, but that still is lower than we were pre-pandemic. So we're working very hard trying to be sure that our children get those vaccinations that they need. So that we continue in Kentucky to not have any outbreaks. So that brings us to how does one get a vaccination, one might ask? Well, we have something called the Vaccine for Children, or VFC program. I'm sure you've heard that phrase mentioned before. VFC is for 18 and younger. So 18 and younger, if they qualify, then there are 641 providers in the state of Kentucky. These are providers at health departments, federally qualified health centers, rural health centers, private providers' offices, pharmacies, birthing hospitals. These providers can give those recommended vaccines to these children. We are still with our regular funding, and we are, as Dr. Stack says, we're moving forward till we learn something different. And so we are very pleased. We've got 13 new locations that we added this year, and right now we have 12 providers in the queue. We are getting them certified to be VFC providers. So I'm going to put in the chat in here just a second. If you or someone you know wants to be a VFC provider, we'll give you that link so you can look into that and see if you would want to try to qualify for that program. I've got 3 slides here. I did some screenshots of some programs that we have on our DPH website, and I put at the top here, this is how I found this website. I just Googled CHFS plus DPH plus measles, because as you know, our website, our addresses are like this long. So even when I'm trying to, I learned that from Veronica Judy Cecil. I went to a meeting when I first started here, and she said, just Google it and you'll find it. So that's how I Googled, and this is what I found. So we have a measles page, really important. 1-800, there's a 855 toll-free number for measles. So if you have, or someone you know has a measles question, this page has got that number that you can call through regular business hours, Eastern Standard Time. So this page has a lot of information that we're not going to go over today because it's there for your availability. You can see on the left-hand side, there's other illnesses that you can check out on our webpage. The next slide goes down a little bit further on that page. Oh, well, that didn't come out right. It's supposed, that red circle is supposed to be around that purple words right there. Thank you. So right underneath this unfortunate child, if you scroll down the page, you'll find DPH immunization outreach. And so if you click on that, you get the next slide, which is the immunization outreach page. This is a really helpful page for providers, for the public. We've got all kinds of information. There's the vaccination schedule depending on age. We've got different flyers. We've got a toolkit for vaccinations. That page has just got a wealth of information. So we would very much want to push people. I've always not liked that phrase, to push people to a website, but we really do want to push you to this website because I think it will answer a lot of questions that people might have, to alleviate some fears or to inform them so they can ask more informed questions when they call their provider. So we have that 1-800 number for measles for anyone in the state to call, and we've got a lot of information that you can get on that website and get credible information about not only measles but other vaccine diseases that can be prevented by vaccination. So those are the things I wanted to point out. What questions could I answer for the group?
Great. Thank you so much for that overview, Dr. White. I think having these resources at our fingertips is really important, and it's helpful to see the website here. I actually did Google it myself this morning. I Googled Kentucky measles just to see what would pop up, and this was the first website that popped up, which was great to see. So we know that people will be at least, getting that as a first search option and hopefully clicking on the right information to begin with. I think anything else you can share about, the Vaccine for Children's program and just what people can do if they're having a hard time finding a provider. I believe you also have a number where people can call and just that helps people to locate a place that they can go in their community. And health departments are often one of those locations, along with some of the federally qualified health centers and others. Oh, I think
I muted myself as I was sniffing through my bring allergies. Uh, yes, your local health department will know who does VFC. I don't have that number, but I bet if you Google CHFS or DPH and VFC, that's where that resource is. But I think all of our health departments do this. I know most of our FQHCs and RHCs, or many of them, are involved in this program. It, we are very proud that we are all across the state and try to position ourselves in places that will lower barriers for people getting access to those vaccines, because they are life changing for us to be sure we reach herd immunity.
Yeah, absolutely. And especially in times when there are disasters, measles might not be one of those, illnesses that we have to vaccinate for whenever we have a tornado or flooding. But there are other things like TB, for instance, that we are really trying to make sure people are aware of and know that they need to get a vaccine whenever some of these disasters happen. So I think it's just something for people to, keep top of mind. And if you are looking for any of these resources, please reach out, use the resources that Dr. White just shared. We'll find the number that we also, like to promote for people who are searching for a vaccine provider, and we can put that in the chat as well.
Yes.
And then one final reminder is that pharmacies are now able to vaccinate children ages 5 and up. And so in certain communities where you may have fewer providers, a pharmacy can be a very convenient place to go. So keep that in mind as well.
Yeah, Dr. Winter, our state epidemiologist, after I got this information and it was listed in the list, but she came back and said, please be sure and remind people that they can go to the pharmacies. They have been a wonderful partner for us around the state. So don't forget that. And I will put that phone number for you to reach out to find VFC providers in the chat here in just a second.
Great. Thanks very much. And remember, everyone, to just put any questions that you have in the chat. We don't have any right now, so I think I'll hand it over to Jessica Klein to give us some updates around food access. And in the meantime, we'll drop some more resources in the chat.
Great. Thank you so much, Emily. Hi, my name is Jessica Klein. I'm a policy associate with Kentucky Center for Economic Policy, focusing on food access today. And I'm lucky enough to be joined by Roger McCann, Executive Administrator with DCBS, Department for Community-Based Services. Thank you for being here, Roger. I think at first, with all of the mention about disasters, we wanted to talk a little bit about Disaster SNAP, which is the program that provides food assistance supports and different flexibilities during an emergency. And I'm wondering, Roger, if you can give us an update on Disaster SNAP and kind of what we can expect in the next few weeks.
Sure. So we currently have 24 counties that are eligible for the individual assistance. That's the DSNAP. We're getting those out now. So information will be coming out here very shortly on that. We also, of course, have 2 counties that were affected by tornadoes last week. We've already been in contact with FNS. Now there has to be survey damage survey and those sorts of things, and we have to put in a formal request and all that. But as soon as possible, we will. We expect, we hope that if we get approval, that we will be able to do DSNAP in those counties as well. So the process sometimes takes a little time. And we try to get it to go as fast as possible, but we have to just kind of wait sometimes and do that. But our communication with FNS remains good. They told us that they would do everything possible to expedite it, and knew that people are in need, and that this is a great way to help them. So moving forward with it, and we're hoping we get a little break. We're starting to get good at DSNAP. We don't want to be good at disasters, but that's kind of where we are at the moment. I see more storms coming through today, and I hope that doesn't impact any more communities and cause more. But if it does, we're ready to go. So.
Thanks, Roger. And for folks following along, we can share some of those counties, but I wanted to make sure people knew, Roger, where should they look for updates on Disaster SNAP?
We have it on our website, and I'm sorry, I don't have a link at the moment. But we do that, and we're also doing social media posts, and we want to get that information out to our partners so they can distribute that. We've been notifying some of the emergency management folks in those areas so that they can, when folks call in. And so just the normal channels on that. And let me just, while we're here, I'll see if I can get a link and I'll post it up for you.
Thanks, Roger. Yeah, I know that money has to be spent really quickly, and everything moves quickly with DSNAP once it is finally approved. So we'll be sure to share those out on social media as well. Okay, and then the second piece I wanted to check in on and let everyone know about is the summer EBT program, maybe being called Sunbucks. That's a question for you, Roger, but it's the program that helps provide grocery money to families with kids, school-age children that are low income during the summer. So could you give us a little update on summer EBT?
Sure. So yeah, we ran summer EBT last year. It is not a replacement for pandemic EBT. It sounds similar, and people say, "Oh, it's the new plan." It's a different program, but it's similar. And what it tries to do is help boost households' budgets for those summer months. The kids, I know when my kids would be there in the summer, eat us out of house and home, especially when they were in their teens. And so if they were getting, a free lunch during the year, they come home for the summer and they don't have that. So that impacts that household's budget. So what it does is it's 3 months of funding, $40 a month. That's per student. So that's $120 benefit for the summer per student. And the way there's a couple ways that we distribute or administer that. So the first way is that if you are already qualified, so let's say a household is receiving SNAP, some foster children involved, a couple other programs that is already in our system that we already know, that we already have that income eligibility information on, we can go ahead and issue the benefit if they are of compulsory school age. So that's 6 to 18 in Kentucky, right? So knowing that, we can go ahead, we can batch process that, and we can go ahead and distribute that benefit. We distribute that onto their existing EBT card. I want to remind everybody that that does expire. They need to spend those funds out over the summer. Okay. Don't delay. But we go ahead and do that. That is touchless. The folks that are eligible don't have to do anything. They receive the benefit. So Saturday, when we got it out sooner this year, we did it last year, worked out some kinks, got it better this year. This past Saturday, we did our first release, and I have that we did a right around 385,000 students, and that's right around $46.2 million in benefits. Those have been applied to the cards. I've already heard from a couple of the beneficiaries of that that it showed up over the weekend. Now, I mentioned that if we already in the system, what if they're not in the system? So if they're not in the system, if we don't know who they are, if we don't have that eligibility, you have to do an application. So if we have that application, then we can go ahead and process that eligibility. What I also point out is that if your household is going to apply for that, you might take the time to apply for SNAP because that also gets you the benefit because you would then be eligible. But you can do that. You can do that application. The other thing that happens is that for those folks who we know are income eligible, if they have a school-age child who is less than 6 or above 18, and there's not a lot, but there's some, they will need to apply and they need to demonstrate that they are in school. So they have to have that information. What we do is we collect that electronically from the schools. Occasionally, a school won't report it. We have a way to verify. But if they go through that application process, we can verify their income, we can verify their eligibility, and we can verify that they are enrolled in school and get them that benefit as well. We wish we could do everybody as fast and electronically as we did on Saturday, but those are the rules, and that's what we have to do. So that will be available through the summer. I will tell you that we had a lower intake of them last year than we had expected. We hope that with more social media, more getting the word out, more explaining the program, and that having gone through it the first year, we'll have a lot more applicants. But yeah, let folks know they can apply for summer EBT.
Thank you, Roger. And I also heard from a lot of people with benefits that they got their summer EBT over the weekend. So just a big thank you for getting that out. And we went ahead and put the application link in the chat. So please be sure to share that out, folks. But I think that's everything we have for food, unless there was anything else, Roger, you wanted to mention today.
All good. Thank you.
All right, thank you. And I think with that, we're going to move on to Medicaid. Is that right, Emily?
Sorry, I had to find my unmute button. We can move on to Medicaid. I'm assuming that Secretary Friedlander hasn't joined us yet. Okay. So I don't think I said this at the top of the call, and I apologize for that, folks, but Secretary Friedlander had another meeting, and we knew he was going to be running a little bit late. So that's why we started the agenda with immunizations. And whenever he is able to join us, we will get to those federal updates. But yeah, why don't we go ahead and go through our Medicaid updates now? Thanks.
Excellent. Well, thank you. Hi, everyone. I'm Priscilla Easterling. I'm the Director of Outreach and Enrollment for KVH. Sorry. Can you hear me okay? Okay, great.
Yeah, we can hear you.
Just double checking. I had a moment of panic that I'm just talking into the ether. So today we're going to cover some health updates. And I'm really excited to be joined with several special guests. We're going to start with David Very, who's going to talk about Kentucky's uninsured.
Okay. You want me to just speak about it or present some slides? What do you want, Priscilla?
If you have slides that you can share, that'd be wonderful.
I do.
I always love a visual. Thank you for joining us today, David.
Oh, gladly. The weather is still holding here.
I hear the thunderstorms rumbling above.
And I'm trying to hear how I can share it. We on Zoom?
Yes.
There we go. Share. Sorry, folks.
I just have to say that if you saw me jump just now, one of those bolts just hit right outside my house. So I jumped out of my seat, David.
it's grumbling here. Hopefully you weren't jumping out of the seat with the uninsured rate. Can everyone see my screen?
Yes, thank you.
Okay, so where we are, as we all know, back in 2014, when we expanded Medicaid to the 138 population and others, and also opened up the state-based exchange at the same time, we slashed our uninsured rate from in the mid-20s down to 5 and 5.4 is where we are now. It's upwards around 6, around there, depending on who you talk to. So that's really fantastic. The last 5% is the hardest. So if we could get below 3%, that would be considered universal coverage. We'd be up there with Massachusetts and those other states. So that's tough. Let's see. There we go. So you can see the kind of trend. This shouldn't be too news for everyone, where we used to be awful. And then we had made the big chunk in 2014, and we've been staying around the same. We had a little uptick in the uninsured rate for the pandemic and other things, and we're still kind of hovering around that pesky 5 to 6%. There is a great disparity, though. This upper chart line here, that's our Hispanic population, and they remain in the 20% uninsured. They are the largest group by race or ethnicity by far. As you can see, the other ones are all grouped kind of together. So that still remains one of our biggest challenges. Even though that the Hispanic population is the largest percentage, overall, because of the demographics of our state, most of the uninsured, which are estimated in the 250,000 or so, 160 some odd thousand of them are white Kentuckians, as would be expected because of the makeup of the state. So it puts us in this kind of in-between place where we really want to focus on the most vulnerable, but we want to make sure we capture everybody and get anyone we can to join us. Most of the uninsured are probably employed. Most have at least one member with a full-time job, and probably a third are Medicaid eligible. They just don't know it. The 19 to 35-year-old group is one of the larger groups, not a majority, but a larger of other age brackets. Those are in health insurance biz called the young invincibles. Those are the people that we want to be insured because they keep the risk pool down. And twice as many males are uninsured than females. This is the big delta. With all of our technology and the self-service portal and all this, there's 150,000 of Kentuckians who don't have access to the internet, and 70,000 don't own a cell phone. So that means the ground game of getting out there and doing the hard work, neighbor to neighbor, holding the events in the communities is of the utmost importance. Some of the SNAP of our SNAP recipients, actually don't have Medicaid and are uninsured. So that's kind of a reverse, but equally as important of trying to get everybody who's applying for Medicaid to see what SNAP's all about. But we really should have that number be a lot closer too. The main reason here is that people think it's unaffordable or don't know. Of course, if people are not able to get Medicaid or Medicare or other insurance through their work, that's what the marketplace is for. It's small compared to Medicaid, about 100,000 people over the course of the year, but it remains an option. The problem there becomes messaging, because the number one barrier here at the bottom is that most people who are not insured because they at least believe it is not affordable. That's where the challenge comes in. Okay, Mary Lou Renton. This is public information, and there were news stories about it, but she was uninsured until last year and was on GoFundMe trying to raise money for millions of dollars of medical bills because she couldn't afford it. Good news is we think that she's insured now, but if she doesn't know about the affordable options are, how many others with far fewer resources are also in that same bucket? Cost is by far the factor. So we need to make sure that our plans remain as affordable as possible, that people who are Medicaid eligible know it and sign up for that better benefit whenever they are able. We still remain the only state-based exchange marketplace in the country that halfway through the year, April or so, if people are Medicaid eligible, we remove them from their qualified health plan that they're paying for, and we automatically enroll them in Medicaid so they can take advantage of that better benefit. How do we get to better get that pesky 5%? Well, this comes from actually a national study, and it's the stuff that we're already doing. The radio ads, even those local radio ads, bus and TV ads, mass texting, voice drops, door to door. Exactly what we're doing. We just need to do more of it. We do have some systems changes in the work for the marketplace open enrollment that's coming up. The good news about when marketplace open, the exchange Connect Insurance has its open enrollment is that we get a lot of people who come in and then they find out they're Medicaid eligible. So a lot of these application flow and RFI flow changes are going to benefit everybody, with some changes, of course, to how to shop for a QHP would be marketplace specific, but it should help capture anyone and get them what we want, people in the best coverage for their situation. We did that on the marketplace last year, where these numbers are obviously went up 20,000, but more importantly, we saw a 52% increase in persons of color and a 127% increase of enrollments by the Hispanic population. So this is small compared to the Medicaid numbers because it's, again, the QHP population, but it does show that trend. It just so we are making a dent. So we hope to keep that going. We hope to keep the momentum that we have, and whatever federal challenges that I think we're going to talk about later on in the call that are headed our way, we'll overcome those, we'll mitigate those, and we'll get through this.
Thank
And
you,
I'll
David. And
pause to see. I did that all in one breath, Priscilla.
I
But,
know.
I'll pause to see if anybody has any questions or comments, or if we get those all at the end, I'll look in the chat. Thank you,
Yeah,
Priscilla, for inviting me.
Thank you. You nailed that. I think you did a really great job of really also laying out that continuum between Medicaid and marketplace coverage and how important they are to each other. So many folks transition throughout the year multiple times as their income changes, as their household situations change, and just knowing that there are probably 100,000, 110,000, I think you said, folks out there who are Medicaid eligible today that just don't know about it.
Right.
That really speaks to like the ground game that we really need to do and how important it is that we educate as many folks as we can about, the great benefits of Medicaid and marketplace coverage as a safety net.
And this is where the power of the self-service portal and the connectors and everyone else who's out there using that is. You can make one application and you're actually applying for all forms of Medicaid. You just don't know it.
Yeah.
And we're the only state that does that too. But that means people who might not know, I don't know if I qualify for anything. Hopefully they get that application in and then, at least they've started down the process. So we'll get there, Priscilla.
Yeah, absolutely. And continuing to support all of the folks on the ground who help get this information into people's hands, who get the resources, connect to other connectors, all of that stuff. So thank you for that. We'll get to those marketplace changes at the end. For now, let's move on to the community engagement waiver with Dr. Hoffman. Thank you again, David.
Just making sure you can see my screen.
Yes, we can.
Okay. Leslie Hoffman, and I am one of the deputy commissioners in the Department of Medicaid, as Priscilla said, and I'm going to go over the Kentucky Community Section 1115 demonstration program today. Thank you for inviting me. Let's just get started. For the agenda, I've got an introduction, an overview of the proposed community engagement program, information about our public forums, information about our public notice and our comment process. One thing that I need to remind everybody of today is that we are actually in our official public comment phase, so we cannot answer a lot of questions during this forum. They have to be submitted to the public comment website, and I will share that information with you at the end of this meeting. Okay, let's get started. So to comply with Kentucky's House Bill 695, the Cabinet for Health and Family Services, CHFS, is requesting federal approval to implement a community engagement program. To request federal approval, CHFS is submitting a Section 1115 demonstration proposal to the Center for Medicare and Medicaid Services, CMS, which is our authority. CHFS Department for Medicaid Services, which is DMS, plans to implement the community engagement program around 24 months after receiving the federal approval. So what is a community engagement program? In 2025, Kentucky passed the legislation, House Bill 695. The law instructs the Cabinet for Health and Family Services to start a community engagement program. With this new program, CHFS will automatically refer certain Medicaid members to the Department of Workforce Development, DWD, for job support and coaching. The DWD will reach out to these members to provide information about job assistance. Which Medicaid members, you heard me say certain, which Medicaid members are impacted? The community engagement program will apply to individuals in the Medicaid expansion eligibility group who have been enrolled in Medicaid for more than 12 months, are between the ages of 19 and 60 years of age, are physically and mentally able to work as defined by CHFS, our cabinet, are not current caregivers of a dependent child under the age of 18 or a dependent disabled adult relative. Okay. Do we have exemptions? Sure we do. So here's a list of our exemptions. CHFS will exempt Medicaid expansion eligibility group members who meet at least one of the following conditions from an automatic referral to the Department of Workforce Development, DWD. That's individuals that are under 19 or over the age of 60, individuals responsible for care of a dependent child under the age of 18, or a dependent disabled adult relative, individuals with a diagnosed SUD, substance use disorder, or SMI, serious mental illness, a chronic disease as determined by CHFS, a acute medical condition, physical or behavioral, that would prevent them from complying with these requirements. Individuals whose eligibility have been determined based on disability or who have been deemed disabled by the Social Security Administration, SSA. Individuals with verified earned income, individuals receiving unemployment insurance income benefits, pregnant women, individuals who are homeless or who were recently made homeless for up to 6 months post-housing, individuals who are victims of domestic violence, individuals who have recently been directly impacted by a catastrophic event such as a natural disaster, which we just had, this week. Oh goodness, I just let go of my screen. I'm so sorry. Hang on. I'm so sorry. There, can you see it okay?
Yes.
Sorry, I was closing out a message coming through. Individuals who have recently been directly impacted by a catastrophic event such as a natural disaster or a death of a family member that's living in the same household. Individuals already participating in a workforce participation program, which we have here in Kentucky, that CHFS has determined that meets the objective of the Community Engagement Waiver Program. So a lot of these members also cross-reference with current SNAP benefits. Former foster youth up to age 26, and other good cause exemptions as approved by CHFS. So we're working on a lot of areas right now. One may be a self-attestation process that we will ask members to also self-attest to things like a good cause exemption. Okay, so here is our community engagement and waiver timeline. April the 4th through May the 13th was to develop the waiver. According to the bill, we had 90 days to actually submit. May the 13th through June the 12th, which we're currently in, is the official public comment period. June the 25th is our date to submit to CMS. Now, lots of things go on, right? We've got public comment. We have to wait for the public comment to be completed. We will also have forums. I'm going to go over those things with you. We also will get the Q&A back about the public comment and get those things posted, all before submission to CMS. So if you've been involved in any of our 1115 demonstration programs, you probably have seen that there are lots of components that go along with an 1115. So even after CMS approves, we don't go live that day. There's lots of components that we have to complete along the way, and usually those components take quite some time to complete and get approval to actually implement the 1115. So the implementation plan, we plan to submit that 90 to 120 days post-approval, 60 days for corrections after CMS feedback. There's also a monitoring protocol that we have to develop and submit to CMS that will take 120 to 150 days post-approval. There is also an evaluation design. The evaluation design should be submitted around 120 to 100 days post-approval. There is a midpoint assessment that will occur within 90 days of the third year after the approval, and a final evaluation within the 18 months of the end of the demonstration. I'm sharing this with you just to let you know there's a lot of components that go along with the 1115s. And so I'm just sharing some of those with you. We will also have to obtain and maintain a outside vendor to complete an independent assessment of the program. Okay, so let's talk about the public forums. So we will be having 2 public forums, and they're going to be provided, one virtually only and one that is in person. Our Medicaid Advisory Committee was graciously, if Dr. Sheila Schuster is online, she has graciously allowed us to utilize part of her MAC meeting that will be coming up on May the 22nd. I believe the meeting starts at 9:30, and we will be utilizing the 10 to 11 slot on her agenda to go through the public forum number 1. So all that information is there, and you will get a copy of this PowerPoint. Our public forum number 2 will be an in-person only, and it will be Friday, May the 23rd, the very next day, also at the same time slot, 10 to 11. So I hope you will join us. We want to get public comment and engagement with our Kentuckians, and this will be at the Kentucky Transportation Cabinet, 200 Merrow Street, Frankfort, Kentucky, 40622. And there are several rooms within that building when you go in. So it's auditorium C105. Okay, so public notice and comments. Although I cannot answer your questions today on this forum, we will be asking you to go over to this website, and I just checked it a few minutes ago. That's why it's purple. It is working, and to make your public comment in the appropriate manner so that it can be fully incorporated into all of our questions that we will have out with questions and answers, as well as going to CMS. The comment inquiries can be submitted via email, received on or before the 12th. Even if we receive them after the 12th, as long as they're postmarked by the 12th, to this Kentucky 1115 Community Engagement website, this will be good. And also written comments can be postmarked by June the 22nd and just be mailed via our post office services. So, and there's the addresses. If you have any general questions, we can answer those. But again, I can't answer a whole lot that's not already public comment or that was in House Bill 695. And Emily, I did check the link just real quick. I know if you are familiar with our other 1115s, we have changed. Let me just share this if you don't mind, just real quick, Emily. Let me just move it over here. I think it'll be beneficial for folks to see. So if you go to that link, this is what you're going to see. We've renamed this title to Section 1115 Demonstration Waivers. So the first one you'll see is Section 1115 Demonstration Community Engagement. And this will be the status. And these are your friendly links here that you can get into. So I just wanted to share that. I know that this is going to be a separate demonstration from the other programs that we have. And I know it's a little confusing for folks. So we moved it up to the top.
Awesome. Thank you so much.
Priscilla, that is it.
Perfect. Awesome. That is super helpful. And I want to bump what Emily put in the chat. KVH is releasing a public comment, a comment collector tomorrow that will go up in our follow-up email. And those public forum dates are this Thursday, the 22nd, from 10 to 11 virtually during the same time as the MAC meeting. And then Friday in person at the Transportation Cabinet in Frankfort, also 10 to 11. In C105, I believe. Perfect. Awesome. If y'all have a chance to join, please make sure to participate. It's a great opportunity to hear more and share, hear a little bit more details about all of this. And thank you so much, Dr. Hoffman, for walking through all of this with us.
Absolutely. Thank you for having me.
Yeah. All right. With that, let's move on to Deputy Commissioner Veronica Judy Cecil to talk about child renewals.
Hi, good afternoon, everyone. It's a pleasure to be here with you today. I'm going to share some slides, and if I can go a little bit off topic for just a moment, Priscilla, I do want to remind folks, because this is really important, our flexibilities that we've been operating under, the child renewal automatic extensions has been one of them, are coming to an end. And there are 5 critical ones. The child renewal that we've been automatically extending children. They've not had to go through an actual renewal. At the time of their renewal, when their month came up, we automatically extended them for 12 months. Our automatic extensions for folks who did not respond to a renewal. So we have been, if we hadn't received a renewal packet or a response to an active renewal by the renewal date, we automatically extended everyone for a month. And if you were long-term care and 1915C waiver members, we could extend you up to 3 months if we had not received your renewal packet. That goes away on June 30th. So after that date, if folks don't respond within that renewal deadline, we have no choice but to go ahead and disenroll them or terminate them. We can't give them that extra time. The other kind of really important thing is during the unwinding, we've been allowed to have an authorized representative sign an application or renewal form over the telephone. But now, after June 30th, if there is not a signed designation on file with us, we can't accept that. Now, we can still accept a telephone signature, but if an authorized representative is going to do it on behalf of a member, that designation has to be with us. And then the last thing is we have been automatically reinstating folks if they came back within 90 days of their termination and provided the information we need to make an eligibility determination and approve them. And that is also going away on June 30th. So we will not be able to do that automatic reinstatement within that 90-day period. So that will affect folks too, because we will likely start to see gaps in coverage from their termination date to when they get reinstated or actually have to reapply. So what does that mean? And this really is applicable to child renewals that are getting ready to restart, is that we've got to be able to reach folks. So you've heard us talk about this all the time, but we just want to reemphasize it's very important that our members keep their information updated with us. We encourage anyone who interacts with a member, if you ask them if they've changed their address or contact information, have they notified the state? It's just really important for us to know that information. So we're going to continue to really drive that home with providers when members come in for their appointments. And for any of you that work directly with members, just please always just bring that up occasionally to say if you've had any change, make sure you report it and that they respond to the letters they get, because we're going to be entering a time where we're not going to be able to do those automatic extensions or that reinstatement. And so it's more important for folks to respond within the time frame that's been given them for their renewal. So let's talk about child renewals. So they are restarting with July renewals. What that means is, we always send that. So July 31st is their renewal due date. We always send those notices about 60 days prior to that. So in early June, they could still be automatically renewed possibly through that passive renewal process where we go out and we try to check the systems and the databases and see if we can automatically renew them based on the information that comes back. So starting in early June, we'll do those for those kids and their cases and their families, households, and we might be able to passively renew them. But if not, then they will drop down to an active renewal, and a renewal packet will be sent on behalf of that child or household. We try to remind folks that children's eligibility is different. It's a higher federal poverty level limit. And so it's really important for folks just to send that in and let us take a look and make a determination because they do have quite a bit higher poverty limit that they can, income limit that they can meet. So just, always still encouraging folks, let us make that determination. If you, even if you think you're not eligible, go ahead and send it in and let us process that. We've got a really great child renewal information packet on our Unwinding website. And what you see here are some of the flyers we created to be shared out. These are flyers we're really encouraging folks to pull down, send out, post. If you know other organizations that work with families, if you could please share it and far and wide. We're asking, providers to also, make members aware as they come in, especially if they see children. The information packet that is on our website has a lot of frequently asked questions. If you all go out and check that out and you think we're missing a question, let us know. We're happy to add that and update it. We really tried to cover all the bases, but sometimes we miss things. So happy to update that if there's something that's missing that's helpful to folks. This is being distributed, as I said, far and wide. We're working with schools, the Friskies, great organization, great folks in the schools that help Medicaid members on a daily basis. They are going to help us get this information out. We have connectors that attend school events. I was made aware that there was a vaccination at a school recently, and so connectors are there. And we're going to be telling folks child renewals are starting. So just make sure that you're watching when your child's renewal date month is, and respond if there's a need for an active renewal with that. So here is the website. You can Google Medicaid Kentucky Medicaid Unwinding. It'll get you there. It's under all the child renewal packet, and all those flyers are under the communication materials. So that's where you can find all that information.
Awesome. Thank you so much. Yes, I love your slides as usual. There's a lot of super helpful information in here, and the toolkit that you guys have put together is very helpful. We've been sharing that out with folks. Please make sure to access that. If you have flyers that you want to share with folks, we really want to make sure to get the word out about children's renewals, especially considering that these start in July. We're very concerned in the middle of the summer, without those handy dandy friskies right there every day to sort of help make that connection for folks. So we want to make sure that everyone knows that it's happening. So if you have any suggestions about any other resources, definitely lift those up and share those, and any other ways to get the word out. Yes, so I did want to ask a question that was in the chat. And Veronica, I know, Deputy Commissioner, I know that you covered this during the stakeholder meeting last week, but there were those reports about children in Louisville who were on waivers, who were being deemed ineligible and lost their coverage. Can you share the update about that, just for everyone on this call?
Absolutely, and thank you for bringing that up. We did discover, and thanks for folks letting us know. That's kind of sometimes what we have to rely on is things are starting to bubble up, and we appreciate that people outreach to us and let us know, and we could take a look into what was going on. What was happening is the level of care assessment. And annually we are required, it's a federal requirement, to do an annual reassessment for eligibility for those waivers. And what we discovered is back in January, there was a new reviewer who was just the way they were applying the level of care criteria was just, it was different. And so we started to see a couple of denials, and then we started to see more denials. So what we have done as a result of that is the department is going back and re-reviewing every single denial since January for the HCB waiver, and making sure that that determination was appropriate. If obviously, if it was not appropriate to deny the child, we're going to reinstate immediately and notify families. We did send out a letter to every family. Those were mailed on Friday. We're calling every single family or reaching the guardian of every child to make sure they know that we know that it happened. We're looking at the case. I want to remind folks, I mean, sometimes kids aren't eligible, and we do see, it's not unusual to see a couple of denials a month, but it did escalate up to a very significant number, and we just greatly apologize to the families. We know that that was a difficult thing to navigate, and we're doing our best to correct it and do the right thing.
Thank you for that. And I think that, again, that really emphasizes the point of how important it is that folks know what's going on, know that renewals are happening, and make sure that they take action. We do not want to see any kids losing coverage at all. And to Emily, she dropped the reminder in the chat. For a family of 4, the federal poverty limit for the adults is around 41,000. But for the kids, it's over 70,000. So the limit for children is just so much higher. Do not assume that just because the parents are not eligible, that the kids are not eligible. Definitely make sure to submit your information, have folks submit applications, and let the system determine eligibility. So if you need any resources or any help like that, make sure to reach out to connectors, check out that webpage and the link of the toolkit with more information about child renewals. And otherwise, just reach out if you're seeing anything or you're hearing anything strange. Elevate those stories, because that's how we make sure to catch issues before a ton of people lose coverage or get caught up in, accidents or mistakes, missteps, all of that. So, all right, with that, keeping an eye on the time, let's move over to the Mac and Back recruitment. Also very excited that this is going on right now. And so, Veronica, it is your floor.
Thank you. I've got a couple slides on this, and of course we'll share all these. Just a reminder real quick for folks to remember that there was a federal rule that required states to create a new beneficiary advisory council if they had not already. And then to make changes to what was the old advisory council on medical assistance. It is now called the Medicaid Advisory Committee. And so there were different requirements that the states had to impose on those as well. So that's how we got to where we are today. We did try there is a state statute, KRS 205540, and that statute is what created the advisory council, the current one. We had filed legislation to try to amend that state statute, but it did not get out of the 2025 legislative session. So we are working on regulations, but in the meantime, to ensure we're compliant by July 9th. And this is not a federal rule that we think is going to change, because some federal rules are being paused, but this isn't one of them. We went ahead and launched on April 28th the changes for the state to be in compliance. So let's talk about the new Beneficiary Advisory Council. We're very excited about this. We are going to have a 15-member council. 10 of those are going to be current and former Medicaid members, and 5 are going to be representing parents, guardians, or paid or unpaid caregivers. I do want to note, so on our current advisory council, we already have 3 people that fit this description. 2 of them are actual Medicaid members, and 1 is a parent. So we already have 3 folks that are going to make up that 15 member council. And a new federal requirement is that there has to be a certain percentage of back members on the new Medicaid Advisory Committee. So up to 25% by 2027 is required that of the Medicaid Advisory Committee, 25% of those have to be from the Beneficiary Advisory Council. So Kentucky is going ahead and implementing the 25%, and to do that with what our new Medicaid Advisory Committee is going to look like, there'll be 7 Beneficiary Advisory Council members on that MAC. And that'll include the 3 that currently are on that current advisory council, and then 4 new ones that come from the back. Just make sure everyone understands, it's the Medicaid commissioner in every state, or director. They're called Medicaid director in some states, but it's that Medicaid commissioner or director who appoints the members to both the Beneficiary Advisory Council and the Medicaid Advisory Committee. To launch the new council, we are going to stagger terms. We'll have a 2-year, 3-year, or 4-year term, evenly across the members, as evenly as we can get with 15 across the all the members that are being appointed. A couple of other things after that initial staggered term, all terms will be 4 years, and members are not able to serve back-to-back terms. They do have to sit out for a period of time. So they could be reappointed, and the period of time that they'll have to sit out is that 4-year term period. So they could be reappointed after that if they want to continue to serve. We are looking to try to get a really great diverse population across geographically the state, the different populations in Medicaid. We've got waivers, we've got managed care, the elderly, children. So we're really trying to get a good makeup of membership that really reflects the entire population and its diversity. So that we're really going to be looking at that as we receive applications. The first meeting we anticipate will be in September, but once everyone's appointed and we have the ability to communicate with the members, they're going to get to decide when these meetings are. It's going to be what's convenient for them. So we were really going to keep that in mind, that we are here to serve them on this council and make it their council, that they get to make decisions on when they meet, what their subject matters are, what their agenda items are. So the other thing I want to mention is we really plan a lot of robust support for members that are on the back. We will be calling them on a regular basis. We're going to have dedicated staff to the back to call them, to help them navigate. Do they need help with transportation, personal needs? Do they need somebody to support them to actually participate in the meetings? We'll be having folks call them to walk through the information that's provided, especially on if the ones that served on the MAC, to make sure they understand the agenda items. What do they need? So any assistive type of support they might need, we'll be providing for them, and we'll be reaching out to them to identify what their needs are. It'll be very individual focused on what their needs are. So if you have an interest, you meet any of those 2 categories, a former or current member or a parent, caregiver, or guardian, we ask that you apply. The deadline is May 29th. We already have about 10 applications, maybe 12 applications. We're really excited about that. But we would love to get more, just so that we can make sure we're having that diversity in place for the makeup of the membership. Here's the QR code, but if you have questions, we create a new email, a new website. The website also has frequently asked questions on it that hopefully is helpful to folks if they're trying to decide. We will help somebody fill out the application. So if they just want to call, we can take the application by phone. We're happy to do that. Just whatever we can do to make it easy for folks to understand the new council and how to apply. And then, do you have something?
No, go ahead.
Okay. Just very quickly, the Medicaid Advisory Committee, We are going to maintain the membership that's in the current state statute. And then we're going to kind of blend in all the federal requirements to it. So it's a little bit different. The new Medicaid Advisory Committee will add 4 what we call ex officio non-voting members. And they're called ex officio because they're there because of their position on a state agency. So currently, the Secretary of the Cabinet appoints someone in an ex officio to the Advisory Council. That will remain, but we will also add 4 new dedicated ex officios, and that's from Department for Public Health, for Behavioral Health, Developmental and Intellectual Disabilities, for the Department for Community-Based Services, and then for the Department for Medicaid Services, because Medicaid has to be on there. So those 4 will be added. So there'll be a total of 5. The 13 organizations that get to nominate someone from the current state statute will continue, but we've added a new one because the federal rule requires a Medicaid managed care organization to be represented on the new MAC. So the Kentucky Association of Health Plans, who is the organization that represents the 5 Medicaid managed care organizations, will get to nominate somebody. The 5 consumer advocates under the state statute will remain. We've made no change to that. And then there's that 7 new members from the back. Go ahead.
Sorry, this is such good information,
Yeah.
but we need to move on. I'm
Of
so sorry to cut you
No
off.
problem. Well, here's the information. We've got a website for the MAC as well. We are, if you are interested in being appointed by an organization, you have to be affiliated with the organization. But I will say we have 2 advocacy groups. People can direct apply to represent either someone reentering society or the women's group. So we encourage folks to definitely show their interest, and we're excited to launch this in July.
Hey, thank you. This is such good information. I get lost in your PowerPoints because they're so informative. Sorry to cut you short, David, but we do need to switch over to the marketplace. And I know that Secretary Friedlander has joined. David, would you have like 2 minutes to do just a quick overview?
2 minutes. Yep, here we go. You know how it was optimistic? We're going to keep the momentum going. Yeah, scrap that. There are dire clouds that are on the federal horizon, and they're not going to go into effect in 2029 or 2028. They're going to go into effect before the end of the year. The first is established federal law. The enhanced part of the tax credits will be disappearing. That's not all the tax credit for APTC. That's just the part that was instituted by ARPA way back when during the pandemic. What that means in Kentucky, and most people will see their premiums increase by a factor of 110%. Anyone on the marketplace. We're going to go from an average of about $139 to over $220. That's average. Some people will see all of their APTC taken away. Some will see increases of a monthly premium of over $1,200. So
that's so much
this
funny.
is not going to be fun. There is the possibility that Congress may act. It will take congressional action to reverse this. We will not know until September, possibly late September. So we're going to have to educate consumers on how to navigate this, how to stay enrolled, how to look for the plan that best fits them. But wait, there's more. There's the big, beautiful bill, that's what they're calling it, that's before Congress right now that they will be talking about at 1 o'clock in the morning. There is nothing good about this for the marketplace, for Medicaid combined. The problem with the marketplace is, sorry, everyone, this is happening this year, not 2 years or 3 years down the road. They're talking about completely eliminating the 150 special enrollment reason, many more red tape restrictions on what you have to do to prove your income, to prove your citizenship before some of it, even before you even enroll, shortening the period of time that you have to get your documents in, eliminating the movement of bronze people to silver, plans where they have more benefits during the open enrollment period. And probably the scariest, to be honest, the shortening of the open enrollment period, where it will end December the 15th instead of January the 15th. So I said that all in one breath. I'm trying to get under the 2 minutes. I'm speaking as, as a Kentuckian. If anyone has time to call their congressperson, now is the time to do that. In particular,
Amen.
Senator Rand Paul. He's on the Finance Committee. He will be accepting the big, beautiful bill probably Monday and be doing that process there before they kick it back to the House. So now is the time.
Yeah.
And I'll pause. And if anyone wants more information, give me a call. I can give you more. That was under 2 minutes, Priscilla.
You nailed it. Thank you so much. Great point. Call your legislators, let them know what the impact of your health insurance going up, what those costs would look like. Let them know this matters to you.
Thank you, Emily, for dropping that about the 4 million average. The Urban Institute estimates that we will lose half our enrollments.
Yeah.
45,000.
Yeah.
And they're not coming back either. So
they're not coming back.
Let's go. We can get through this. We're going to shock the nation by how many we keep.
Amen. I love that attitude. All right. Well, on that perfect tee up for federal updates, let's throw it to Dustin and Secretary Friedlander. Thank you, everyone, for joining us for the health section.
Yeah, thank you. Well, like David said, there's a lot going on the federal level right now. Obviously, I think a lot of folks have been keeping up with the congressional action, but aside from that, there have been a lot of federal action, and Medicaid is not the only state and federal partnership that the cabinet administers. There's a lot going on right now with some formal cuts to grants to the state, but also just ways that HHS has been restructured and sort of made it more difficult for the cabinet to go about its normal business without somebody answering the phone on the other end of the line in Washington, D.C. So we invited Secretary Friedlander to come on and share a little bit about kind of where things stand with programs like LIHEAP and SAMHSA and tobacco cessation and other things that we do on a regular basis. And before I give him a chance to speak, I also want to recognize that I think this is our last Thrive CHFS forum with you, Mr. Secretary, and I just can't tell you how much we've appreciated your leadership and your clarity of purpose, and also your transparency with us as a group and with the public writ large. And we just really, really appreciate all the things you've done for the Commonwealth and the opportunity to partner with you in that way. So with that, I'll let you be the bearer of some bad news.
Yeah, I mean, what a note to kind of end on. It's hard to know where to start, so I'll start with the stuff that's not congressional action, more DOJ action is how I'll say that. Dustin, as you said, we have experienced, like everybody I know at the Administration for Children and Families, many people that I know at SNAP and WIC, not all, but many, and then people at HRSA and our friend Jason Dunn. I mean, there are people who are no longer there, and it is kind of frightening, frankly, how many people are gone. And so you're right. Who's answering the phone? Who can tell us what's going on? And for quite a while, people were absolutely prohibited from talking to us. They couldn't communicate with us. We called, they say we can't talk, or they wouldn't respond. I mean, there are people that I've known really personally who are still there that I sent personal texts to, and they were afraid to respond. Afraid. That's the only word for it. So that was kind of the start, right? And then we started, there's this payment management systems, and it gets all into the bureaucratic piece, but basically it's the pipeline of money that comes to the state, right? It's how the federal government moves money from them to us. And they shut it down for a little bit. And it was a disaster. And we weren't able to get a Medicaid payment one time. And Medicaid payments, trust me, are huge. And so we had to adjust how we asked for things. We had to assume that there were going to be a couple of days extra in whatever we were going to ask for. And so that was just, and to me, you know, let's just show everybody where we're very, very vulnerable from an economic perspective. And it just kind of demonstrated that there's this one pipeline, it's the best way to say it, that you can shut down and like shut down the entire country, essentially, in all the states. So that has been really frightening. Then, of course, all the anti-DEI, all of the inclusion pieces, and then just kind of DOGE cuts in general that impacted AmeriCorps, that impacted public health, that impacted behavioral health, that impacted all sorts of programs that many states, what they did was, once they got the notification that the funding wasn't coming, they told people to shut down. That has not been our philosophy here. I say to all the folks here, we are to act as a shock absorber. And so when those funding cutoffs or funding cutoffs came down and we got notified that this funding was going to be cut off, we decided to fight. The governor decided to fight. He's in on a lot of the lawsuits that have been filed about, hey, this money was passed by Congress. There's no congressional action associated with. You can't just cut off funding one day. And so I think we made a good bet, I think, and there have been several now court rulings that the programs get to continue. And so the AmeriCorps one's coming up soon. And so we're hopeful that what we said is we don't want to create more chaos, right? Chaos is part of the point. So rather than create more chaos, right, or pass the chaos directly through, we're like, no, we'll take a risk and not throw everybody into disarray. Now, everybody reads the newspapers. They know that funding's been cut off, but we've been clear, I think, with most of our programs when we can, that we're going to continue and we're going to try to fight. And like I said, we've done that, and we've done that pretty successfully. But there are things like we just found out the other day, the support for behavioral health in the natural disasters. Mm-hmm. That's been cut off. They've told us there's nobody there. Honestly, this is what was said. There's nobody there to approve the funding and get it sent to the state, so therefore the state doesn't need to expect it. So it's that kind of chaos. I don't know how else to describe it. Right? That we're dealing with at the federal level. And so again, we're trying to be a shock absorber here. We believe that you have to have congressional action to make the changes that the DOGE has been putting in place. So with that, I think that's how we've navigated it. Whether that ends up being right or wrong, I can't tell you. We hope we're making the right decision, because the state will be on the hook for if it goes the other way. But again, I feel very strongly, and the governor feels very strongly, that these are very important programs, right? We've seen opioid death rates go down. Now's not the time to stop, right? Now's the time to continue. So that's the choice we're making at this point. So that's been a large piece of what's been happening. And then, so you can think you're safe from the DOGE, or you can think you're safe from budget reconciliation, and one or the other will get you. But then we've got all this budget reconciliation piece. And as we look at it, Medicaid was not as horrible as I thought it was going to be. SNAP is much worse than I thought it was going to be. And those are just two examples, right? Medicaid ended up work requirements, right, which we all kind of know, and that we're going to try to implement them in as least impactful way on the folks we're trying to serve as we possibly can, and we're working on that. And then Leslie put in we've got some forums on what we're trying to do pre any of the kind of in response to 695. And like I say, we're working to be as light on the recipients as we possibly can, while still complying with the legislation. And I hope that we've been able to achieve that. So there's that piece. The pieces that concern me, we had a law passed early on to do away with co-pays and premiums. And now we're going to have to put co-pays and premiums on if you look at the legislation. We've got a state law that says you don't do it. So how do you reconcile those two things, or when do they go into effect? You know, the discussion has been they're looking at 29, or they're, you know, whatever the years are that they're putting out. But now they're trying to bring some of those timeframes back as it goes through the regular congressional action. So we don't know that yet. Looks like it leaves the HRIP program, kind of grandfathers it in place. Doesn't look like, I was worried about some FMAP reductions, some federal percentage reductions. Again, don't really see that. At least the ones that are in there don't impact Kentucky. But still, those requirements, some of the narrowing of the range around accepting income, right? And what happens with that when we accept a range of income, and now that looks like we really don't get to accept the range. We definitely don't get to accept the range that we were doing, and that range gets narrowed and narrowed and narrowed, which means then there'll be more of that back and forth, more proving your income eligibility, more proving that it matches what we have in the federal system. That's just an increase in paperwork, which we know that increase in paperwork, as you heard kind of discussed earlier, no matter what it is going to result in more folks losing their coverage. And so that's not great news. And David talked about what's happening on the HBE side and the advanced payment tax credits and all of that, and the narrowing of the window. So all of this is, you know, the design is fewer and fewer people eligible for healthcare. I have tried to enlist the help from the hospitals, because anytime they have served somebody that's uninsured, that hurts their bottom line. And, you know, it's all about the patient until it's about the money. So I'm hoping that to provide some encouragement in that way. And they've been, I will give them credit. They've gone to DC. Of course, they effectively took the HRIP piece off the table for them, which again is a good thing. But those are the continuing challenges just in Medicaid. The piece that I'm most concerned about, and the more I read and the more I understand, the more concerned I become, is the SNAP piece. We've never had to have state participation in SNAP, meaning we never had to come up with state dollars for SNAP. And so just the benefit side of it. So they're basing it on error rates, and Kentucky has a pretty low error rate. We run a good SNAP program. We're one of the states that could potentially fall in the 5% range. We're at about, Roger, 4.5% error rate today. I think we're around in there. And that would put us at having to come up with 5% of SNAP benefits, which is a 5% is probably 50, 60 million, somewhere in that neighborhood. And so if we stayed in that category, it would be one thing. But the federal government, as I read through it, has changed how they're going to compute the error rate. They're going to have like zero tolerance for any of that, you know, not necessarily flexibility income, but how we determine eligibility and how we determine what somebody's eligible for. And we were able to, you know, get within a range of a few dollars here and there. Well, they're doing, you can have no variance, zero. That's going to increase everybody's error rate, right? And it's you know, it's just, you all know, going through SNAP, what's your rent, what's your utility, what's all this, right? All of that's going away. They're taking away the internet, right? So you can't even compute internet in some of the pieces that make you eligible or increase your eligibility for more support. So that's going away. And there are a few other pieces that I'm really concerned are going to increase our error rate, because there's the $0 one in particular, right? And there are a couple of other little ones in there that, you know, if we go up above, what is it, 6% or 7% error rate, which isn't that far, all of a sudden we go from 5% participation to 15. Now remember, that's about 50 or 60 per 5. And if it goes up more than that and we end up in the 25% range, that's huge, right? That's a huge amount of money that the state will need to put in. They're also changing how we do SNAP administration dollars. And you know, that's I won't get into that. SNAP administration dollars, which come in at a 50-50 match rate. And they're going to change that to only a 25% federal participation rate. Well, that increases our cost, probably another 50 million. So you're just at the bare minimum, you're talking about 100, 110, 115 million that the General Assembly, see House Bill 7, right, may or may not want to participate in. That starts to be, that 150 starts to be a sizable number for the state to participate in SNAP. And nobody knows what happens. At least I haven't seen what happens. What if the state doesn't come up with it? Does that mean you don't get to administer a SNAP program at all? I don't know, right? I wish I could tell you because I actually don't know. I don't know if Roger, you know that or not, but I'm very worried about what that could mean, and it's really, really unclear. And we also lost the program that, you know, with farms and food banks. So food banks don't have the same connection to farms, which is what SNAP is supposed to be about. They're losing that connection, the support for that connection. It's a big deal. At the same time that we've been trying to encourage like hospital kitchens to buy local and school kitchens to buy local and everybody to buy local to support the farms and as we do the kind of and so there are all sorts of pieces that are going to make SNAP one less dollar support for individuals, right? When with what's that marketplace food basket? I know I'm calling it the wrong thing, but you know that that's going to be a reduction. So those are tremendous 50 food plan. Thank you. Those are tremendous issues. Those are really going to be difficult. And we're, you know, again, call your congressman, talk to your legislator. It's going to be so difficult to say to the General Assembly that wanted to like limit SNAP benefits, and now on top of that you're going to have to pay more if there are more people in SNAP. So that's just going to feed into some of that House Bill 7 desire on the part of the General Assembly. It just is, right? I'm not, you know, looking at a crystal ball. It's just, of course it is. So those are big pieces. LIHEAP, maybe, you know, the rumors are LIHEAP is under attack, TANF's under attack, although we didn't really see the TANF changes that I thought we were going to see. But that doesn't mean as it goes through the process that it won't come back. CSBG was actually looked like it wasn't. Again, I was worried that it was going away, period. So that doesn't appear yet to be the case. Let me say it that way. So there are all of basically the public assistance programs and safety nets, which we all know are threadbare anyway, are going to get more threadbare, worse. And please remember, because this is a talking point that I've heard supporters of this approach say, oh, well, this is about reducing budget deficits. Absolutely, it is not. This is about paying for a tax cut for the wealthiest individuals in this country. So this has nothing to do with budget reduction, zero. So when somebody says that to you in your community, it's just not accurate, right? What this is about funding tax cuts, period. That's all it's about. So it is a tremendous wealth transfer from the poorest among us to the richest among us. That's all this is. So I say all of that, keep your eyes peeled. The rumor on the street is the General House wants to do more to Medicaid that's been done in this committee at this point. Who knows what the Senate's going to do? But you know, the number of senators that have to switch votes at this point is a higher bar. It is a higher bar than it's ever been to get this through. So I'm very worried about this. I would love to say I think, oh, this is posturing, this isn't going to happen. I'm very worried about this and the impacts to our communities. We just made homelessness. We just criminalized homelessness. So it's going to be more difficult to stay housed. It's going to be more difficult to get sufficient food. It's going to be more difficult, likely. And again, we'll see what happens to LIHEAP, but I'm concerned that that's going to get hit along the way. So less support for folks to stay housed. And I'm very worried about it. And that is, you know, I wish I could paint a rosy picture, but there's nothing rosy about this. But it's going to take everybody here being a strong advocate. Sheila, I was just with some advocates the other day. The voices that make a difference are yours, right? They're not mine. They're not Rogers. They're not Veronica's, right? They are yours. Your legislators listen to you. So that is, you know, an awesome responsibility, but it's one that you can exercise by using your voice. And I want to encourage you all to do that. So I want to say that. I don't know if Dustin and I covered things that you wanted me to cover, but that's kind of a broad, in its own way, a broad overview of what we're seeing from the federal level.
It is far more than I was expecting, and I'm really grateful for it. And I just want to reiterate what you said. This is not a done deal. They are dead serious about it, but it is still just words on paper. It is not yet policy. So reaching out now is really critically important. And I also want to say that, you know, if you hear the secretary talking about this cost shift in SNAP, and you are sort of like, you know, wiping your brow because, oh, good, it doesn't affect the people that I'm serving or I'm helping. If they move $100 to $200 million of responsibility to the state, they are going to cut into other programs to make room for that. And that means cutting into programs in education, in disability services, in long-term care. I really hope you take what he said seriously, that this is an issue that's going to impact everybody, not just food assistance. It's going to crowd out other parts of the budget. And as the General Assembly continues to pursue things like income tax cuts, that pie is only going to get smaller and those pressures are only going to get harder. So I know we're about 10 minutes over, but I really appreciate you sharing everything, Secretary Friedlander. And again, all of the ways that you've served us and the Commonwealth. I think we're better off for it. So I'll hand it to Emily to wrap us up.
Yeah, we just couldn't have said any of that better ourselves. Thank you so much for being here, Secretary. Thank you, Dr. White, for being here. I hope you get to join us for another forum. I know that Deputy Secretary Carrie Banahan wasn't able to join us today because of a funeral that she had to attend, and we're so sorry that she couldn't join us for a last forum before she retires. But your leadership and your advocacy has just been phenomenal, and you will be missed. And we will be following up with information about evaluation, CEUs, other events, keeping you posted with toolkits and resources and calls to action. So look for those emails from us, and please stay in touch. Have a good afternoon, everyone. Bye.